To this day I still ask myself, what did I see on that ultrasound? Some years ago, I was an intern completing my last few years of medical training. Here in Mexico, they basically make you rotate through 6 medical services so you can get experience in all of them, always with a certified medical doctor as your mentor. Urgent care, pediatrics, family medicine, surgery, and internal medicine were all pretty hard, but with time I got the hang of it and was able to do my job as an intern with minimum effort and actually learned a lot. However, I will never forget how both amazing and scary obstetrics can be. I'm not talking from a medical standpoint either. Watching a baby human be born from inside another human's body is surreal. If I were to describe this process to a kid, he would probably be terrified and maybe think that it's something closer to alien science fiction than to actual human biology. When I got to my first rounds at the obstetrics hospital in my city, I was already pretty nervous. This field already had some pretty challenging practices, assisting a delivery, taking care of high-risk pregnancies, C-sections, etc. After some time, the knowledge I acquired allowed me to be more efficient, empathetic, and to understand pregnancy better. There was this one case, however, that still makes me scratch my head every time I remember it. It was a young woman, aged around 20, who we will call Jane for anonymity purposes. She arrived at our emergency area of the hospital in distress, sweating, and apparently experiencing some pain. She was from another country and only spoke what seemed like French. She was probably in the last few weeks of her pregnancy. I was called to assist. We helped her get to an individual room where we could lay her down, perform a physical exam, and do an ultrasound. My mentor was trying his best to communicate, and Jane actually seemed to understand what he was saying, but any word she uttered was incomprehensible to us. Even if we were able to understand her, the pain was too much and she could barely say anything. My mentor ordered me to start an ultrasound while he went to find a translator. I began preparing the machine and reassuring Jane that everything was going to be alright when, actually, I was really scared since my ultrasound skills were very, very bad. I tried to remember my training while moving the transducer to get an image of her uterus. As soon as I started to get a visual of the fetus, something felt off. The uterus was extremely big, and I had not noticed it until the ultrasound. I was a student after all. Then it started to appear on the screen. I don't know how to even describe it, the image of a fetus, but at the same time something I hadn't really seen before. The more I moved the transducer to get a clearer image, the more scared I felt, building the actual 3D shape of the fetus in my imagination. As I was beginning to scan the head of the fetus, I was startled by the sudden grip of Jane's arm around my arm that was moving the transducer, while she started to get agitated, saying all these weird words to me with a worrying face. I dropped the transducer and looked at her, speechless. My mentor entered the room, saw me drop the transducer, and ordered me furiously to get out of the room. I was just shocked, from her reaction, what I saw on the ultrasound, and the image of the fetus in my head. My mentor went in with Jane and closed the door. Meanwhile, I was starting to walk away from the room. After a few seconds, I heard a scream, both from my mentor and Jane, so loud that all of the staff nearby entered to help. Other doctors immediately ordered me to go to the hospitalization area to see if they needed help until the situation was controlled. The next day I learned that a new mentor was assigned to me, as the previous one had resigned. I accepted it without asking questions, but deep down I was very scared of the whole situation. Apparently, Jane was transferred to another hospital. I asked on multiple occasions what happened in that examination room, but every person I asked gave me a short explanation: he fainted. He began to feel sick. He had a panic attack from overworking. I did not want to touch an ultrasound machine ever again. Now I am a licensed medical doctor and I consult patients on my own. Recently, I went out with my colleagues who were fellow interns with me at the same hospital program. I learned that one of them worked as an emergency care intern at the hospital that Jane was transferred to around that same time. I talked to him about that specific case and asked if he knew anything about it. He was quite shocked. He said that they were expecting an important pregnancy arrival from another hospital, but the ambulance crashed on the way there and only the paramedics were found dead at the scene. It was big news at the hospital he was working at. Even though he can't confirm it was the same patient, I was already shaking just thinking about the possibility. Now every time a pregnancy comes to my office, I am very scared to open their ultrasound images and see that horrible shape again. What do you think? Tell us in the comments. Like the video and hit the subscribe button for more Reddit stories.